Okay, so the psychological first aid crisis intervention is extremely common, and it's used generally immediately following a natural disaster. So, the Psychological First Aid Field Operations Guide was created by a collaboration between the National Child Traumatic Stress Network, the National Center for Post Traumatic Stress Disorder, and mental health providers. So, the intended purpose of the guide was to address the need for a common disaster mental health response method that was developmentally sensitive, evidence informed, and could be widely implemented, and could also be used by many types of providers. So, psychological first aid involves mitigating acute distress and fostering adaptive coping skills. It can be used in a triage setting, which basically means assessing an individual's needs and determining the need for follow up services that may not be immediately available. Referral, liaison, and advocacy are necessary components for implementing this crisis intervention. So, this particular intervention is appropriate for many types of psychological crisis. It's suitable for training professionals and it's applicable to a broad range of disaster events. Um, Psychological first aid usually involves contact and engagement, safety and comfort, stabilization, information gathering, practical assistance, connection with social supports, information on coping, and linkage with collaborative services. Okay, so some ethical considerations. So, supervision and consultation are extremely important when utilizing crisis interventions with the crisis theory due to potential burnout. So, you want to ensure that as a social worker, you are providing the best practice to clients. Crisis intervention, although it is short term and brief, it can be exhausting from a clinical perspective, constantly working with individuals who experience extreme levels of stress and constantly working with populations who have dealt with trauma. So clinicians can sometimes may feel burned out. So seeking supervision to ensure that you're providing the best care possible is important as always. And navigating the multiple interventions that could potentially be used with clients with a supervisor is very important to ensure that you're attaining to the NASW Code of Ethics. Okay, so research in crisis intervention is still greatly needed. Research in crisis intervention has not kept pace with its use. So crisis interventions they're used on a daily basis. They're being used constantly and consistently, but the research is just not consistent with its use. More research is needed. Crisis theory doesn't have, as I previously stated, unique interventions, but more research surrounding specific crises and the benefits of the brief intervention are still needed. Long term interventions may be useful with some individuals, so certain crises do require a long term approach as opposed to something that is so short term. So, some of the interventions I mentioned previously involved maybe 5 sessions, and so sometimes clients would benefit more if they had, for example, 10 or 15 sessions. They may feel like they'd have a more positive outcome in that instance to deal with their trauma as opposed to doing something so brief and short term. So, that is an ethical consideration to think about prior to using a short term crisis intervention. So, some rural environment considerations when using crisis intervention. So, there is a potential for a lack of resources in rural environments. There's generally gaps in access to transportation, gaps in access to services, high unemployment rates, and things like that that prevent clients from being able to access resources that you may link them to. Like I said, linkage to sources and environmental resources that's extremely important when applying crisis interventions, and so that may be a barrier in rural environments. Clients may not be able to access those resources. Social workers are also more likely to have larger caseloads in rural environments just due to the lack of clinicians. There may be, for example, one clinical LCSW provider in the area of an entire county. So everyone in one county may be going to that one LCSW, or maybe it might be two or three, but still, to cover an entire county, that'd be a rather large caseload. And for example, if there is a natural disaster, there may be a limited number of qualified social workers to conduct crisis interventions, and so that would mean that your caseload would be significantly larger as opposed to an urban environment. And there's also the risk of dual relationships in rural environments, and that also goes back to the importance of supervision and consultation if this does occur, because rural environments tend to be smaller in terms of community. Everyone knows everyone, and so dual relationships, there's a chance that they may occur, and you would need to be prepared as a clinician to ethically handle that in the instance that that happens. Okay, so the client portrayed in this scenario is experiencing a personal loss due to his uncle recently passing away. The client is 21 years old and is completing his senior year of college. He considered himself to be extremely close to his uncle that passed. He says that his late uncle played a significant role in his upbringing, and he's struggling significantly with coping with the recent loss. In this role play, I will be demonstrating the skill of eliciting and encouraging the client to express painful feelings. I will also demonstrate how linking clients to environmental supports is crucial to successful intervention. Hello, Delana.
I'm Miss Likely. How are you doing?
Well, welcome back. I'm glad to see you here for another therapy session. So, I know that the last time we spoke, you mentioned that your uncle recently passed. And so I just wanted to ask you a couple questions about that. So, can you explain to me exactly what emotions are you feeling regarding his death?
Well, feeling a little bit of anguish and a little bit of disparity. I feel like I've lost an important family member in my life. Things I could just feel won't be the same in my family, and just feeling the loss of his presence. So,
okay. So, how has your uncle's death specifically changed your life?
I feel like my life just won't be the same because I felt like he did his best for me and cared about me a lot, and it sucks, knowing that somebody you grew up knowing passed away and won't ever get to see him again.
Okay, so you're experiencing some negative feelings, some frustration, feeling like things won't be the same in your family.
Yeah, a little bit of that.
Okay, anything else that you have going on you want to discuss?
Yeah, haven't been able to sleep well lately. It's just having them on my mind constantly, and haven't been eating. Haven't been really getting a hold of my schoolwork as of lately, and it's very much. It's been tough. It's been rough.
Okay, so I do want to mention briefly, here at the Grief Center, we do have an all-men's support group specifically for the loss of a loved one. Some of them have lost spouses, siblings, parents, and uncles. So I just wanted to briefly mention that to you. There's not a certain set of sessions that you have to go to. You can go and come as you please. It's open. But that is a resource I did want to offer to you. I have a brochure here that you can look at after our session if you'd like. And also, regarding your school, is there any type of tutoring services or program that you can participate with to help you regain focus? Do you know of?
Yeah, I do think there is some programs that I could get a part of to help me with my schoolwork and get back on track and be more accountable with the rest of my work, especially since it's finals time.
Okay, and I'll also do some research and see what type of resources are available in the community that you could possibly take advantage of. And so the next time that we meet, I definitely want to work on creating some short-term goals, some long-term goals for you in an effort to help you cope better that makes sense.
Yeah.